And many thanks indeed for staying with us. Just before we head to Rio, let's stay with the health status of King Charles III, and let's get to bring in General Practitioner with the National Health Service in England, Dr. Esien Ukorebi, who joins us live now from Birmingham. Dr. Ukorebi, thanks as always to see you. How common is it for doctors to discover cancer diagnosis in patients during regular checkups?
Thank you very much, Kelly, for having me on the show. Well, I would say it is very common for cancers to be picked up during regular routine checkups. As a matter of fact, the National Institute for Health and Care Research, have written that almost 90% of patients with cancer are diagnosed after visiting their GPs or their family doctors in primary care. So this shows the importance of routine regular checkup, especially with the rising trend of cancer cases. I mean, in 2020, the total number of new cases of cancer stood at 18.1 million. And this figure is projected to increase by 55% come 2040. So cancer is on the rise, and I think the more regular checkups people engage in, the more likelihood that they get their cancer diagnosis picked up early. So I think it's not just about picking up cancers in routine checkup, but more importantly, how early the cancer is picked up.
Yes, and the specific type of cancer the king has not been disclosed just yet. But what types of cancers are predisposed to men, especially here in Nigeria?
Well, you're absolutely right. Buckingham Palace have not disclosed specifically what kind of cancer the king has. And, our deepest thoughts and prayers are with the king. But one thing that was said during the announcement is that his cancer was caught early. And for me, that's very important. And to answer your question, the most common cancer globally in men, of course, is prostate cancer. We know that, of course, that's not the cancer the king has got, because that has been stated clearly. But that's the most common cancer in men. And as age increases in men, the likelihood to have prostate cancer also increases. And usually, typically, they present with symptoms with like blood in the urine, problems with passing, urine and things like that. So when these symptoms are seen, people or men are advised to check in with their doctors, with their GPs, to either have a blood test, to check their PSA, or have their prostate examined. There are other cancers that are common in men, like lung cancer and bowel cancer or colorectal cancer. Likewise, in women as well, breast cancer seems to be the most common type of cancer. But Kelly, as I said earlier, the message, surrounding these entire diagnosis of the king's cancer is that it was caught early. And early detection of cancer, greatly increases the chances of successful treatment of cancer. And there are two components of early detection of cancer, which is early diagnosis on the one hand and screening on the other hand. And with early diagnosis, we talk about people who have got symptoms suggestive of cancer, for example, a lump in the breast, vaginal bleeding in postmenopausal women, blood in your urine, weight loss. And these people can present to health facilities on time to encourage early diagnosis for cancer to be detected early. And on the other hand, screening exercise for people who have no symptoms but are otherwise well in themselves to present for screening. For example, women between the ages of 50 and 70 will go for their 3-yearly breast mammogram to screen for breast cancer. Young ladies between the age of 25 and older ladies up to about 64 will go 3-yearly for their cervical pap smear to screen for cervical cancer. And the same with things like bowel cancer for people over the age of 60. So if this is done together with presenting early when you have a suspicious diagnosis, then just a bit like the king, cancer can be caught early.
And Dr. Esien, just before we consider the ways forward, I'd like to squeeze in two questions. We know that age is the #1 risk factor here for most cancers. The king is about 75 years old. How crucial is this? The second part of my question is the fact that in terms of data, the numbers don't lie. In the UK alone, I understand about 1,000 people a day are diagnosed with cancer. Perhaps you can confirm this for us.
You're absolutely correct, Kelly. The age plays a major role in majority of cancers as a big risk factor. And as I said earlier, for example, prostate cancer is more likely to be found, in men above the age of 50. And as these men get towards the age of 70, the chances of having prostate cancer, nearly doubles. So age is a big factor in terms of cancer diagnosis with some specific cancers. And as I said, the incidence of new cases of cancer is on the rise globally. And, in the UK as well, it's not an exception. And yeah, people get diagnosed daily in their thousands in the UK as new diagnoses for cancer, different forms of cancer.
Yes, so Dr. Ukorebi, I mean, we are rounding off now with our interview with you. In this part of the world, we know how when people fall ill, they just get to self-medicate. And some of them say, look, I have malaria, I have typhoid. So what are the early ways? How can we prevent cancers?
Very much, Kelly. It's important to know that 30 to 50% of all cancers are preventable. So that tells us that, we have a high chance of preventing cancer. Earlier on, I talked about, early detection, which is a big step. So early diagnosing and screening for cancers, which is a big step in ensuring that, if it is there, it is caught early. But for people who haven't got cancer at all, then of course there are some lifestyle modifications that can be put in place to reduce your chances of getting a diagnosis of cancer. Of course, one of them is to stop smoking. Smoking alone is the biggest avoidable risk factor for developing cancer. And just smoking alone kills more than 8 million persons per year from cancer and other kinds of illnesses and diseases. So that's one way to prevent cancer diagnosis. Reducing alcohol is also very important. Having a healthy lifestyle. We heard earlier on the show that, that even the king has a strict diet regimen. And so healthy diet is very crucial in terms of preventing cancer, and not just cancer, preventing a wide range of other illnesses and diseases. And of course, staying physically active, ensuring that you're not overweight, you're not obese, you're exercising regularly, because excess body mass index, was responsible for at least 3.4% of all cancers when a study was done in 2012. So it is important to stay fit, it's important to stay healthy, eat healthy as well. Avoid bad habits like smoking, reduce alcohol or stop it completely. And of course, once again, early detection, which involves early diagnosis if you've got a symptom, and presenting regularly for screening for cancers.
And it's a fine place to anchor a conversation with you, Dr. Ukorebi. I mean, you say 30 to 50% of cancer is preventable. And you also say that early detection is pivotal. But thank you indeed. Great analysis as always, Dr. Esien Ukorebi is a general practitioner with the National Health Service in England, live for us in Birmingham.
Thank you.